In addition to that, when we think of how we're going to be reaching communities of color in particular, it is crucial that assisters are trained in cultural competence. A lot of families with mixed immigration status have a significant barrier to overcome when it comes to public charge. Who's helping them understand that this is not a problem for them, that they are welcome in this program? Promotores have been really a successful example in the past of how this has worked well to connect families to Medicaid and CHIP coverage. And so as we sort of cast a wider net, it's important to think about some of those lessons learned. It's also, of course, crucial that, excuse me, get a little bit of water here. It's also crucial that that assisters are able to provide assistance in the language of the consumers they're trying to serve.
Absolutely.
And are able to help them get over some of the literacy barriers that they might otherwise encounter, whether or not English is their primary language or not. We know literacy barriers are going to be significant. So. And then finally, I think just echoing what the other speakers today have said, it's important that those providing assistance are trusted members of the community. Let's see. So I think sort of wrapping up this idea of assisters, I think it's important to think about who is providing assistance. It's not always the folks who are providing kind of the outreach messages, often the family members, often mom or partner providing that assistance, or excuse me, providing sort of the outreach messages. That's one important piece of it, but when we think about who's actually providing assistance or where people might go to learn actually about the application, or how do I get through this, or I started the application and then I struggled and here's where I got stuck, they're going to be going to their providers oftentimes. There's tremendous trust for natural reasons in the healthcare community, in doctors and nurses, in community health centers, in hospitals, and all of those entities need to be prepared either to provide assistance in a formal capacity or understand how to answer some basic questions and provide referrals to those who can provide that formal assistance.